This is MDiTV.
Mayo Clinic cardiologist Arshad Jahangir doesn't have a problem with the herbal remedies millions of us consume every year. He doesn't have a problem, he's got several. Here's his list. Lack of scientific evidence of safety and efficacy, lack of regulatory oversight, lack of quality control, public misinformation, lack of knowledge about herb-drug interactions by patients and healthcare providers, and underreporting of adverse drug reactions. He and his co-authors penned an article for the Journal of the American College of Cardiology, ticking off the list of worries about how herbs and supplements may affect people, especially those who also take prescribed medicines.
The main reason to write the review was to point potential interactions between herbs and medication. And the reason it's important is that a lot of our patients, particularly elderly patients, are taking these products and they are not aware of potential between the medicines they need for their medical conditions and the effect these herbal products can have on metabolism of the drug or the effects of the medicine.
For instance, he says St. John's wort, saw palmetto, and ginkgo biloba can increase the risk of bleeding, seizures, or blood pressure problems. In addition to his concerns about the products themselves, he points out that manufacturers aren't subject to the same standards and inspections as prescription drug makers.
And the problem is that some of these products come from manufactured or at least assembled internationally from either in Asia or other parts of the world. And there is no quality control of those products. And contamination has been found in a lot of these products.
But Jahangir's broadside against herbal preparations gets return fire from naturopathic physician Martin Milner. Milner calls the journal article merely an opinion paper with references.
One of my major concerns with this study is it really wasn't fully honest and fully professional.
Milner is the medical director at the Center for Natural Medicine in Portland, Oregon, and teaches cardiovascular and pulmonary medicine at the National College of Natural Medicine. He says the Cardiology Journal article contains factual errors, including the claim that ginkgo interacts with warfarin, also known as Coumadin, a blood thinner used to reduce the risk of blood clots and strokes.
And ginkgo's been studied in at least 6 or 7 references to actually not have an adverse interaction with warfarin. And there was no study even cited implying that, but it was listed on the table.
Milner also points to what he sees as errors in references to research on saw palmetto, as well as omissions of studies that failed to find problems with herbal products. Browsing the medical literature does indeed produce articles that each side can point to.
So we are not saying that herbs are all bad. The main thing is that we need to understand these potential interactions, identify those pathways that can lead to interactions that can cause bleeding.
The back and forth arguments leave patients confused. And since there are few incentives or requirements that either prescription drug makers or herbal preparation providers study potential interactions in large and expensive clinical trials, the doubt and arguments are likely to persist. For the time being, naturopathic physicians suggest that patients include them in the conversation about drug treatments since they have more training and experience with herbal preparations than MDs do. And both sides urge patients to be sure that all their healthcare providers know about everything they're taking, prescription or not, so they can watch for signs of any interactions between herbs or between medicines.